I'm so glad to see everyone this morning. Um, can't believe it's already December. It's the end of the year, and there's so much that's happening and so much to look forward to. At the Match Coalition, one of the things we like to pause and do at the end of every year is thank all of you for being just supporters of the cause of maternal health and really sort of appreciating the role that technology has and all of the advances that we are making in the space of maternal health. With that, we have an amazing lineup for today. We're super, super excited because I don't know about you, but for me, we're always hearing about AI this and AI that. And it's hard to keep up. We know that there's a lot that's going on in terms of changes and regulations, policies, lots of legislation that's being thrown around. What all of it's about, who knows? Fortunately, at the Match Coalition, we have Elizabeth Frazee here to keep us straight. She's going to be talking to us today, giving a little bit of a legislative update. And then we're going to move on to our member highlight. Super, super excited to have Pacify here to share all of the amazing share about all the amazing services that they offer and how they are equally changing the lives of families around the country. And then where would we be today without our amazing special guest, Dr. Melissa Walsh, who'll be speaking with us as well. Before we get started, I always like to give folks the opportunity to join in and provide any announcements. So if you have any announcements, whether they're national, state, or local, we'd love to hear from you. This is your opportunity. You can either drop them into the chat window or you can use your digital hand and we will bring you on stage so you can make your quick announcement. Any takers for this morning? All right, well, we got a really packed agenda. So if you decide later on you want to make that announcement, just drop it into the chat window for us. We would greatly appreciate that. But without further ado, I'm going to first welcome David Gray and Elizabeth Frazee, who are the co-chairs, the other co-chairs of the Match Coalition. And with that, Elizabeth, I'm going to pass it over to you.
Fantastic, Fran. A few slides on AI and what's going on at the federal level. Now, everyone's heard that there's been a ton of activity in Washington recently around AI. And there was an executive order the end of November from the White House, and that sort of kicked off another work stream of activity. Congress has been working for some time on a lot of activities. The most recent one came out of the administration, and it was Executive Order 14110 for a safe, secure, and trustworthy development and use of AI. Now, this was a culmination of a lot of activity within the administration. They have been working on AI for years. I mean, we all think it's a relatively new thing, but all of the agencies have been grappling with how to deal with it. So on October 30th, President Biden issued the sweeping executive order, and it focuses on AI to advance safety recommendations, bolster data privacy protections, regulate the use of AI technologies across a multitude of private and public sectors. The new recommendations are going to be implemented over a period of 90 to 365 days, with priority given to safety and security requirements, according to an administration official that we spoke with. The EO is expected to face legal challenges, diplomatic challenges, because of course this all goes across international borders. So the key areas the administration focused on were safety and ethical use. I mean, everyone is worried about the ramifications of AI, in particular generative AI, and what that means, and particularly in the healthcare setting. Data privacy, obviously, huge issue in healthcare. And so the AI funds programs to develop cryptographic tools, evaluate how government agencies collect, use data, calls for federal support for privacy preserving tools, and also for legislation. There is the opportunity or the risk of bias in AI. We've all read about it. And so the EO focuses on individual rights and protections to prevent algorithmic discrimination and also innovation, because the US is competing worldwide to be first in artificial intelligence. And that's why the EO promotes national AI research programs and facilitates small business participation. So the directives in the EO fall onto both private companies and public agencies, as I said. The initial thinking was that by embracing some of the protections in AI at the agency level, that would create incentives for the private sector. But they've gone a little bit beyond that. And it has established, the EO establishes criteria for responsible uses for AI in healthcare, education, and the labor market. It offers potential benefit areas for leveraging AI technologies. So here I've identified just the various areas that the EO has touched, including things like safety standards. It requires agency collaboration, content identification. There's a lot of discussion around whether watermarking needs to be used to identify AI content. How does the average user understand that they're interacting with AI as opposed, or recommendations are based off AI as opposed to talking to a human being? There are obviously huge civil rights implications with the use of AI and the way it impacts populations. And then we already mentioned global collaboration and preserving innovation. So there was a lot of work, which I mentioned prior to the EO, that came out most recently. There was an EO back in 2019, maintaining American leadership in artificial intelligence. There's been OMB guidance around the regulation of AI. There was a second, or now third, EO promoting the use of trustworthy AI in the federal government. There's been a blueprint for AI Bill of Rights that came out of the Office of Science and Technology Policy at the White House. There's also been an AI risk management framework that came out of NIST. So all of this work culminated in the most recent AI, and there is a White House AI Council that has been coordinating all of this. There have been 8 guiding principles throughout, and I've already talked about most of them at the top of the EO, but safety and security, innovation and competition, worker support, AI bias and civil rights, consumer protection, privacy, federal use of AI, and international leadership. So one section that stands out in the voluminous EO, that the most recent EO from October 30th, is Section 10, and it regulates the federal use of AI. And so what it's attempting to do is establishing new agency requirements, governance for, and guidance for AI. And we have so many agencies across the federal government, including so many that deal with health, that there were some baselines that the administration believed needed to be followed. The first one is a chief AI officer. Every agency needs to have one within 60 days of the final guidance that will be coming out. There are AI governance boards within the agencies within 60 days of final guidance. They need compliance plans, use case inventories, the roles and responsibilities of the AI officers are laid out, and they also want the agencies to be leading in the area of responsible innovation. So developing an enterprise AI strategy, reducing barriers to the responsible use of AI, and developing the infrastructure within their agencies that would enable the responsible use of AI. So let's look at some of the requirements for HHS, which some point for this group. First, HHS has to develop its AI task force, and that's going to develop the strategic plan that includes policies and frameworks and guidance on the use of AI, long-term safety and real-world performance monitoring, equity principles, incorporate safety, privacy, ad security standards and software development life cycles, work with the SLTT agencies to advance positive use cases and best practices for AI settings, establish an AI safety program in collaboration with the VA and DoD to establish the framework for capturing clinical errors resulting from deployed AI, and develop a strategy for regulating the use of AI in drug development processes. So there's a lot of work that has to be done at the federal agency level, and Congress has also been weighing in with lots of activity. Senator Bill Cassidy, who has spoken to the Match Coalition in the past, he's a ranking member on the Health Committee. He released a white paper on AI, which includes a look at the impact of AI in healthcare, calling on the beneficial uses of AI for research and developing new medicines, diagnosing and treating diseases, supporting patients and providers, addressing healthcare administration and coverage, and safeguarding patient privacy throughout the healthcare cycle. The report concluded there's great potential benefit, but also increased risk within the healthcare setting with the use of AI. And one example of that he pointed out, and you all probably know this, but one leading EHR vendor that developed an algorithm intended to predict whether a patient would develop sepsis came under scrutiny when the Journal of the American Medical Association found it only accurately predicted the occurrence of sepsis 7% of the time. So, in response, FDA proposed guidance for industry in September of 22, asserting authority over these algorithms, requiring them to go through FDA review as medical devices. Obviously, the industry and the government is trying to react in real time to what is occurring in AI and the use of AI. So everyone's probably heard of the Senate AI Insight Forums that Majority Leader Schumer spearheaded. There have been 9 of them. They've been closed doors, and they ended on December 6th. It's been a working group of 4 senators, Senator Chuck Schumer, Todd Young, Martin Heinrich, and Mike Rounds. They came together and wanted to create a game plan for the Senate and Congress in moving forward on a legislative agenda, but they thought the Congress first needs to be educated. And so they brought in 165 witnesses over 9 of these closed door sessions. Some have been better attended than others. In the beginning, there was a lot of enthusiasm for these insight forums. And now that they're over, where does the Senate go? So the co-hosts have indicated that the key committees are now going to be ramping up efforts to craft bipartisan AI legislation in the coming months. And it's time for the committees to take action. Now, they've already had a lot of hearings to date, and too many to mention, and really too many to mention. And a number of them have been in the area of healthcare. The Senate, the House Energy and Commerce Committee's Healthcare Subcommittee recently held a hearing on AI in healthcare. They brought in some of the agencies to testify. It was extremely high level. And the focus around legislation seems to be culminating around transparency in the use of it, making clear that AI is being used without bias and without discrimination. So that is where we are. We can expect legislation to move over the next year. However, Congress isn't getting much accomplished these days, to state the obvious, and they haven't been able to get some of the big issues that I know David's been working on for years, like privacy, across the finish line. So we'll see whether they can get legislation on artificial intelligence. There are a number of bills that have some promise. I won't go into them now. I know we're short on time. So with that, I know, Fran, you said questions. People jot down their questions. If anyone has them, please let me know.
Thank you so much, Elizabeth. That was fantastic update. Very insightful. We really appreciate it. You'd had reference towards the end there about, other areas where we still have a lot of changes that we're waiting to have take place, privacy policies being one of them. And I believe another is also in the telehealth space. David, did you have any super quick update on the telehealth related policies that you wanted to share just really quickly?
Yeah, thanks. On telehealth broadly, I think not not much of an update. A lot of the Medicare, which doesn't really apply to this group, but a lot of the Medicare telehealth benefits, which sort of set the stage for a lot of broader telehealth coverage, expire at the end of 2025. We do expect Congress has to address it either permanently or temporarily. In conjunction with those efforts, we could see sort of either a ripple effect across other telehealth uses, such as for behavioral health or mental health or maternal health, as sort of that work really kicks up next year. But just since this is our last meeting of the year, which is crazy, just wanted to quick final updates on where some maternal health legislation stands, very quickly. The Black Maternal Health Omnibus Act, which is sort of the gold standard for this coalition and a lot of other maternal health focused organizations. It was a good year for it. Numbers were good. A couple of the standalone bills were bipartisan this year, including the Tech to Save Moms Act, which is a telehealth focused one that was not bipartisan last year, at least in the House. We got a couple of Republican co-sponsors this year, which was great show of support for the bill and the premise that digital health can help improve outcomes and increase access. One other sort of area that we were tracking, and we held our last congressional briefing, was around the use of, or the value and support for maternal mortality review committees. The bill that initially propped those up, the Preventing Maternal Deaths Act, it's up for reauthorization. We saw Congressman Burgess and Congresswoman DeGette lead the charge this time around. Both the House and the Senate version of the Preventing Maternal Deaths Reauthorization Act 2023, which would reauthorize a program, provide new and additional resources for MMRCs. It has passed out of both the House and Senate committees, and it's waiting for floor action. But it's a good sign that they're both bipartisan. They're both ready to be passed and signed into law. It's really a question of timing when Congress can fit it in. It probably won't be until next year, but some positive news heading into next year on a small number of maternal health priorities. So we'll keep pushing Congress, keep sending letters, keep bringing up all of the bills that we've supported and the ideas that we're promoting in our advocacy, both individually and as a coalition. But I just wanted to thank everyone in case I don't get a chance at the end of the call. Thank everyone for a great year. I really value these calls. I've learned so much every month. So just wanted to thank you all for showing up and for contributing to the coalition and to the broader push for maternal health. So Fran, let me stop there. Thanks.
Awesome. Thank you so much, David. We appreciate that additional update on some very key items. And if you haven't already signed our letter encouraging your representatives to support these causes, the link is there in the chat window for you. Now, without further ado, it's my honor to be able to introduce you to, and I'm just adding some spotlight here on today's guest speakers are members of the Match Coalition. And if you're wondering, hey, how can I become a member of the Match Coalition? It's pretty simple. Go onto the website, matchcoalition.us, and click on Join Us. There's no cost to participate, but it allows for you to get those updates and also allow for you to have the wonderful opportunity, just as Pacify has today, to share with you all the amazing work that they're doing. So without further ado, I'm going to hand it over to Melanie and Lindsay.
Great. Thank you, Fran, and thank you, everyone. We're just going to be quick. We'll have about 10 minutes. Before I share my screen, I'd like to introduce myself and have Mel introduce herself. My name is Lindsay Leader. I'm actually a family nurse practitioner by background with experience in family medicine and maternal health, and I serve as our Director of Business Development. And Mel?
Yes. Hi, everybody. Thank you so much for having us. My name is Melanie Silverman. I have been here since the beginning, which started in 2014. I'm the Chief Clinical Officer for Pacify. I'm a pediatric registered dietitian and a IBCLC, International Board Certified Lactation Consultant. And we're excited to present our information to you.
All right, so I'm going to share my screen here and let's see. Mel, are you seeing this in presentation mode? Okay.
I am.
Great. So just a little bit of who we are, what we do, what we're passionate about. We really see ourselves as a group that can really provide wraparound maternal health support to really work with our Medicaid, public health, and some health system partners to really help support families through that prenatal and postpartum journey. And really understanding that as much as we are putting efforts towards creating great solutions, there's still a lot of lack of access across our country, both to valuable resources and confusion around what to do through that pregnancy and postpartum journey. And so we really try to meet our members where they are, understanding what resources are available, understanding what the gaps are and what their experience may be, and really trying to provide an equitable solution that can be meaningful for them along their pregnancy and postpartum journey. And when our members connect to our providers, whether they are the doulas or the lactation consultants, we really want to ensure that it is a seamless and empowering experience for our members. I am a clinician, but I'm also a mom of 3, and I know what it's like to be awake in the middle of the night with a screaming infant or be very scared in that pregnancy moment. And we want to make sure that whatever encounter our members have, that they are feeling really strengthened along the way as opposed to defeated. And we know that even though there are a lot of wonderful providers out there, if members cannot connect to the right people at the right time, it can make a world of difference. And so what we do is really try to meet our members where they are along their journey. As I've mentioned, we really have focused our work historically in that prenatal and postpartum journey with both our IBCLCs and doulas, and then connecting also to nurse lines for our Medicaid partners. And in these areas, really helping with what are your hopes for your labor and delivery and their postpartum experience, what resources are available to them, guiding them to their clinical visits when it comes to prenatal and postpartum care, and really exploring what feeding options are available and helping mothers really understand the benefits of breastfeeding. If breastfeeding is not working, how they can feed their baby and wean if needed, really providing 24/7 support. In certain markets, we are building out our in-person doula network, and I won't get into the details of that, but really have determined that, especially as many states are starting to reimburse for doula services, that we can be there to help support doulas in that process, particularly to serve those who are most underserved. So we do in some markets have doulas who can assist through the labor and delivery experience, really helping with that self-advocacy and providing those evidence-based interventions. In terms of who we serve, you'll see a variety here of Medicaid partners, public health, WIC, and some health systems, and really just trying to understand what are our clients' needs, where are the gaps again, and how can we integrate within the offering so that we can try to augment services that are available and not contribute to more fragmentation when it comes to that perinatal journey. I think this next slide really, none of this will be surprising to anyone on this call, but, we have a lot of challenges when it comes to maternal health, and we're not, unfortunately, making huge improvements. We still have poor maternal outcomes. Marcia Dime's recent, report card stating that the infant mortality rate just also increased for the first time in 2 decades. We struggle with engagement challenges. How can people access resources that are available to them? How do they know which resources are available to them in areas of maternity care deserts? How can they receive care? Even in areas that do have resources and hospitals that are open and doing OB, where are they available? Can they get in to be seen? And ultimately, the cost of care continues to rise. So we're still seeing high rates of cesarean delivery, high rates of NICU admission, long lengths of stay. So really, how can we provide a solution with wraparound support? And so what we do is we provide 24/7 access to virtual doulas and lactation consultants across the country, all at the click of a button. We really want to ensure that when someone does click that button, they're connected quickly. So we have guarantees of connection within 3 minutes. Across our book of business right now, that happens in less than 60 seconds. It's a 24/7 solution. So that on-demand feature has been really important for our members. They even if they have resources available to them, they're typically during regular business hours. So to be able to talk to someone in the middle of the night who can really help them with whether it's feeding support or understanding what to expect in the delivery or postpartum experience, that can be really helpful. We also are building out our scheduling capabilities for those who are more comfortable scheduling with the same provider over time. That's coming this year in 2024. And in addition to accessing a live lactation consultant or doula, members have the ability to chat directly with their providers via text message. So really comprehensive virtual solution in addition to the certain areas where we are building out that in-person doula support network. And we really look at how we can address the common challenges. As I've mentioned, there are still going to be people that are very hard to reach, that are the most vulnerable. And we really want to ensure that our solution is not only improving breastfeeding initiation, duration, and overall prenatal and postnatal care, but that we're really immersing ourselves within the member's journey so that we can customize messaging that's going to be empowering, educational for individuals along their journey. We have the ability to take our app with the services we provide and customize it so that it can include plan resources, WIC clinic resources, whatever might be available to our members within their community. And then we really want to take our services and try to create sort of an integrated experience with the teams that we're working with. So we provide team trainings, whether it's WIC clinic staff, whether it is case management, so that they can promote referrals into Pacify, and we can also refer back to those critical providers and resources when needed. I'm going to turn it over to Mel to talk about kind of the common reasons people visit us and a little bit about our provider network.
Yeah, so as many of you may know, when you're pregnant or breastfeeding or whatever kind of feeding that you choose, formula feeding or a combination, you have a lot of questions. And that is why Pacify has existed since 2014. And so, people, they're searching all over the internet, they're asking their family and friends, and they finally, if they have Pacify, they end up with evidence-based information from people who really, really care. And so we have questions with the doula network are incredible. People are afraid sometimes even to ask their doctors some of these questions, and they'll ask our doulas. We're very good about referring people back to their local care. And also empowering people if they don't feel comfortable with their doctor to find another one. I think it's very important, as we all know on this call, to feel comfortable with your doctor, and not a lot of people do. So that's one of the questions that come up sometimes in our doula network. And of course, feeding questions about breastfeeding. Am I doing this right? How do I go back to work? So we can really answer many, many questions from the time you're pregnant until you're having your baby, introducing solid foods. Next slide, please. So a lot of people ask me, who are these lactation consultants and doulas who are staffing the app? Well, I want to assure you, we all know that not all healthcare providers are created equal, meaning they don't give good, solid, caring, supportive information to people. We make sure that the people that we hire for this network certainly have to know what they need to know to become lactation consultants and doulas, but they also need to understand who our audience is, who they're caring for. And so the number one thing that we are concerned with is maternal mental health when people call in. So we have protocols in place for all of that, but we have a very diverse network, people who have at least 10 years of experience in the various areas that we actually support. So Medicaid, public health, and WIC. We ask very specific, thoughtful questions during interviews to really get out what a person is like and how they would treat people who they'd be answering the phone for 24/7. Next slide, please. And so people ask a lot too, what are your policies? How do you go about doing this? We follow the Academy of Breastfeeding Medicine, the CDC. We have clinical protocols so that we may have over 100 people on the network across the country, but they're giving similar advice, similar evidence-based advice. After every single call, there's a chart that surfaces, and so we take notes on the clinical interaction, and we send those to our plan so there's continuity of care. Certainly our app is HIPAA compliant. We have emergency protocols in place, and we can help people if somebody calls and they're having problems locating food or they're having problems with transportation. We have these excellent relationships with our Medicaid plans where we're able to try to loop Medicaid back in to try to help them. And we also support our providers so that they can give good support to the people who call. So we have a really robust library for them, an excellent clinical team that supports them. And, we have 1,000 people waiting to work for Pacify. And I think it's because the rumor's out that it's a wonderful place to work. And people really also 5-star ratings. People love the app.
Thanks, Mel.
Thank
So I'll
you.
just end to talk a little bit about our how we look at outcomes and impact. When we do get data from our health plan partners, we can look at claims data to understand if and where we're having impacts when it comes to these metrics. And then overall, what that long-term effect can be. It really requires a partnership. So I will just, in full transparency, sometimes we get this data, sometimes we don't. But obviously, these are the critical elements we need to be looking at when it comes to improvement of outcomes. And across our clients, we have seen a great increase when we look at the cohorts that have Pacify versus not. We see increase in prenatal visit compliance, increase in postpartum visit compliance, and overall increase in rates of breastfeeding and duration. And in fact, both Mississippi and Louisiana, our WIC partners there, have both done similar studies that have shown very similar outcomes. So again, really trying to understand what resources are already available, where can we really fill the gaps in to help improve outcomes overall. And lastly, it has to be an empowering experience. I think you've heard us say that word a lot. We really value the feedback from our members, and we've been consistent over time with really ensuring wonderful member satisfaction. And so I think when we partner with our clients, we really look at how can we differentiate the experience for our members, really activate engagement, particularly among those most underserved, and really ensure that we're having a meaningful impact when it comes to health outcomes. So I will stop there. Fran, thank you so much for having us, and I will turn it back over to you.
Okay, thank you so much, guys. That was an amazing presentation. I'm sure there many have questions about what you've just covered for us today, and we're going to hold those questions to the end. Hopefully, we'll still have a little bit of time. Now it's without further ado that I introduce everyone to Dr. Melissa Walsh, who is an OBGYN based in Florida and has an amazing background in the space of Web 3.0, as well as AI, and is very much engaged in many of the activities that are happening within the in the technology space when it comes to clinically appropriate applications of the technology. And so we're honored to have you, Melissa, with us today, and I'll go ahead and pass it over to you.
Thank you so much for having me today. And yes, hi everyone. I'm Dr. Melissa Walsh. I'm an OBGYN physician, trained at Einstein Montefiore, worked in the New York City public health system for many years, and also worked in Florida before getting involved in Web3, Femtech, and telehealth. I'm currently the medical director for Pomelo Care, which is a virtual maternity care practice. Going to give a presentation about the value of AI in improving maternal health care and support. It's just an overview of current use cases and research that's been done today. I don't have any financial disclosures or conflicts of interest. This presentation is independent of my function at Pomelo Care. So as we know, we are in an ongoing and worsening U.S. maternal health crisis. We have rising maternal mortality rates that have nearly doubled and have increased since 2018. And more highlighted is that there are growing racial disparities in our country. The maternal mortality rates for Black women and people of color is nearly 3 times higher than that of white women. And there are also many common risk factors that are associated with these rising rates in mortality, but also morbidity, rising rates of hypertension, diabetes, pregnant persons achieving pregnancy or ongoing pregnancy at later gestational, later maternal age, pre-pregnancy weights that are higher than recommended and higher BMIs into the morbid obesity categories, as well as significant gaps in social determinants of health, transportation, food, housing, social support. We're seeing increases in substance use, intimate partner violence, and other factors that are contributing to our worsening maternal health. So when we think about how we can address these issues, my mind goes to how can we leverage technology to improve our maternal care model. And traditionally, we've had a very reactive approach to the thinking about leveraging technology, the applications of AI, which are fairly broad and right now in our current state are looking at the integration of AI algorithms and machine learning to do deeper analysis and integration of electronic medical records. But there are also other applications that are being explored in the realms of monitoring during prenatal care and postpartum care, even in fertility planning, with the integration of AI with the especially medical record systems. We're able to see an advantage in early detection of risks and complications much more in advance than would be anticipated in traditional care, and the ability also to personalize treatment plans. In going into pregnancy monitoring, there are several AI-powered wearables that are being worked on for continuous monitoring, looking at vital signs, fetal movements, and other relevant health metrics such as contraction pattern and glucose control. Almost any metric that you can name that we traditionally measure, a solution is being worked on to integrate that with AI to give the providers and the patients more real-time data to stay on top of better control of blood pressures, glucose, or changes in contractions for those who are at higher risk of preterm birth. This can improve patient insights, provider insights, and also the coordination of care and ability to comply with treatment plans with better understanding. And a, a big area of study has been in the evolution of predictive analytics for identifying patients at higher risk for preeclampsia, gestational diabetes, preterm birth, postpartum hemorrhage. There's been several studies, one that was coming out of UCSF that looked at vital signs, blood pressure, heart rate, to identify signs of hemorrhage. And the system achieved high accuracy, helping their healthcare providers to initiate treatment early, as opposed to reacting to a full hemorrhage after the fact. Another group at the University of Oxford also looked at an AI model that combined multiple factors such as previous medical history, current blood pressures, and some biomarkers such as blood counts and chemistries, which they used to integrate into a model that predicted the risk of preeclampsia. The accuracy varies from upwards of 60 to almost 80, 90%. These are based on, limited populations in certain institutions. So in progress. And looking at SDOH factors, AI integration with EMR has a lot of potential because of the ability to analyze large amounts of data from different sources, especially with natural language processing algorithms that can account for SDOH factors in addition to the medical factors that can impact a patient's risk. These SDOH factors can be combed through from just geographic location and what's known about those areas, as well as ICD-10 codes that may be associated with the patient's past chart to highlight any recent past risks that might compound the risk of other obstetrical complications. There was also another interesting study at the University Stanford that developed an AI algorithm called Elijah, which actually predicted the risk of preterm birth by looking at electronic health records. They later went on to use a wearable tracker to analyze the quality of the contractions of patients who were experiencing preterm labor symptoms. An additional application would be the AI-powered image analysis. So there are models that have been trained on probably upwards of millions of images in all sorts of realms, CAT scans, ultrasounds, or for the purposes of maternal health with fetal images. They have found that the AI is able to recognize visual cues according to fetal age and presentation, which is on par with trained, experienced ultrasonographers. And this can help aid in detection earlier in the pregnancy, counseling, and coordination of care. Finally, another application is the personalization of treatment plans. It kind of draws back on the ability of AI to analyze the electronic health records at a deeper level than would be in the routine day-to-day of an OB provider, and taking into account if there's availability of real-time data, such as coordination with a wearable for real-time continuous glucose monitoring that can help integrate better fine-tune plans into diabetes management or other factors impacting the pregnancy. With any new technology, new innovation, there's always consideration for the risks. There are obviously many benefits, as we've discussed, but several risks, especially highlighted off of Elizabeth's review of the new federal regulation proposals. I think in the medical field, there is, a top concern that I would consider is their trust and acceptance of the use of this technology and the integration into our day-to-day workflows. I think that comes from unfamiliarity with the technology and some highlighting that, the logic or decision-making logic behind the AI is not always so transparent. So that can create mistrust of the technology. Additionally, as discussed before, there are biases that can arise in AI algorithms, and which highlights the importance of having diverse population data sets, as well as wider availability of those data sets to researchers and health systems, to help with the basically evolution of the machine learning, so that there is a better reflection of the general population. Ethical concerns related to AI stem really from, these biases that might be inherent depending on what data set the AI has been trained from, the acceptance of the AI technology, and the ability to balance between using this advanced technology while maintaining a human-centered approach and taking all factors into consideration when taking care of the patient. Other ethical concerns being addressed with regulatory and legal challenges, as we have learned about before, as well as EMR data and privacy and security, which is always an underlying concern with any new technology. And that also highlights the need for, stricter encryption and regulation of the security of AI, since some of the data can be pooled, and we must do everything that we can on the tech side, which I'm not so familiar with, to ensure that that data is protected. And finally, there are numerous future opportunities for AI. There's advancements in wearable technologies to produce more comprehensive real-time monitoring, improving predictive analytics for accurate predictions through de-identified patient data across collaborative platforms. This would help us immensely in a population health level, especially in light of the crisis that's ongoing in maternal health. Natural language processing algorithms that can enhance the knowledge base from not only just EMR, but patient feedback and input through wearables, or data entry through an app or at the visit, as well as current medical literature. There is always an opportunity for increased accessibility with AI-driven maternal health care through integration with VR and other emerging technologies, telehealth included, to improve access to patients, especially those in rural or OB deserts. That is my talk for today. Thank you so much for having me here. I just think that we're just at the very beginning phase of the integration of AI with healthcare, and it's super important that all of us in the field are participants in the evolution of this technology, to build trust and also for applicability to our patients. Thank you.
Well, thank you so much, Melissa. That was an amazing overview of some of the critical applications that we really have the opportunity to further advance. Feel a little bit squishy around those numbers of confidence of, I think was like a plus or minus 30%. It's a little high. But I think showing that at least we're making the attempts to get there. And one thing that you did point out in that is that it's really about the size of the populations, right? I think back to some of the older studies in epidemiology where we were looking at infectious disease, and the recommendations were being made off of populations of 10. Obviously those numbers were quite skewed. So continued engagement of large, diverse pools of individuals in these research initiatives are really important. But it just boggles me. I mean, you'd mentioned about, for example, real-time access to real-time data, and yet in spaces like maternal health, we don't even have continuous glucose monitoring, right? CGM isn't even an option. with gestational diabetics. And so I'm curious to know what your thoughts are in terms of some of the, the gaps that are happening here, the mismatch between areas where we're seeing real progress being made with the technology, but yet within the space of maternal and infant health seems to be quite slow to progress.
Yes, definitely. I think that is maybe a little bit reflective of the medical field in general. We're a little hesitant with the adaptation of new technologies. Even the EMR, when that was first introduced, people swore that they were going to keep using paper in some way or form, and now we're all on EHR. And what we've learned from that is that healthcare professionals were not intimately involved in the evolution of the EHR. And I think that's why it's so important for us to be involved in the evolution of these advancing technologies. Almost everyone has access to a phone or the internet in some way or form. We need to configure a way for that access to be meaningful for moms from every background, because having access to more data, knowledge, education, and this technology to reinforce those learnings, I think is the way forward. In terms of CGM in gestational diabetics, that is being explored on a case-by-case basis. There is a fair amount of discussion that has to go into that with the insurance companies, but we're seeing with the recurrent issue of missing proper glucose monitoring by the patient because of a number of factors, and a lot of that could be related to patient anxieties, but also more so access SDOH factors that impact their ability to get to the pharmacy, to get to appointments, to get refills, those simple things that with the integration of technology we could curtail all of that and make sure that they are able to have the supplies when needed. Hopefully grow a bigger cohort of patients that have experience with continuous glucose monitoring, make that the new standard as we go forward.
Yes, let's definitely hope. I know, thinking back on other areas where, we continue to lag not only on the medical side, but also in, supporting entrepreneurs. I mean, Melanie and the team from Pacify were established back in 2014. I'm sure that, like ourselves at Reach Healthcare and many others, you've seen the slow progression of investment being made into the maternal health space, and that's kind of resulted in a little bit of suffering in the context of expectant families not having access to resources that they so desperately need. Do you care to make any comment about the investor landscape as it pertains to what we see with AI and other technologies related to maternal health?
Well, I mean, I think at the time, this was 2014 when we were looking for investors to start everything, and there was a interest. There's been great interest, since then, as we see so many companies have formed out of that. But we need more. I don't know how to explain it. I'm so passionate about what we've been doing for so long. But I mean, I've always said I think that every single person who delivers a baby in the United States should have access to Pacify or some sort of lactation and doula support. So there needs to be more done. And my hope is that there will be.
Well, let me add to that. I'll add. Oh, sorry. Go ahead, Lindsay.
I was just going to echo. I think what's hard is that we continue to be so backwards with our health system in general, is that if we continue to be reactive and need to prove ROI, in this way, but don't put any resources towards prevention for any of these things, because it doesn't instantly, it's not this quick fix. I think continuously that's where we get stuck, right? Things like preventive care, things like glucose monitoring, things like educating mothers about what the feeding options are all critical and have these downstream effects. But people often are saying, well, where's the how can I fix the problem in 12 months? And what's that ROI? And it's such a bigger issue. And so I think it's really about stepping back and looking at, okay, how do we kind of redirect the ship in general?
Yeah, it's kind of ironic though. I mean, there's some real numbers to back this up, right? Where we have 3%, approximate 3% investment and overall in women's health related technologies. I think that's a problem. I'm excited to go to CES 2024 is January the 9th through the 12th. And excited to be in Vegas to see what new things are coming and how much of that will be represented by Femtech and the folks from the FQ are going to be there as well, having their equity lounge. So we're excited to see that. But if we talk about RI, if you think about it, 9 months of just a gestational period, and to know that we can reduce the number of premature labors and reduction of cesareans, and better management of hypertension and overall education for nutrition for both mother and baby, and the list goes on and on. It probably has a better return, at least in relation to human health and wellness, than any other technology I've ever seen. I would love to know what others think about that, or any questions you might have for our guest speakers today. We had a lot of talk on policy. Elizabeth, is there any further you'd like to share, or any questions anyone like to ask of Elizabeth?
I think we've covered it all, and the speakers following me were fantastic. Thank you. We have certainly so much talent today, and there's so far to go, though, as you just pointed out, Fran.
Yeah. I can't believe we're already out of time. Everybody, it's been amazing. Thank you so much for, again, your commitment to maternal health and to the Match Coalition. We're going to be starting a little bit of a campaign coming into the new year. We're going to be circulating a survey to get your feedback, to make sure we're covering the topics that you'd like to see. And we're also going to be pushing a Bring a Friend campaign. Bring a friend or colleague to these sessions so that we can boost up the amount of participation. I know we're competing against a lot of other programs that are going out, but we're hopeful to see more people engaged over time. And I'd also like to say thank you, Carrie, for joining us, and the Preeclampsia Foundation. They're doing amazing work, and we are in fact seeing the application of AI technology in much of the research that's happening in the prevention of preeclampsia. And if you guys would like to learn more about the Preeclampsia Foundation, please do visit them at the preeclampsia.org website. All right. Thank you, everybody. Happy holidays. And I can't wait to see you in the new year.
Yeah.
Thank you, everyone. Happy holidays.
Great meeting.